it is.
Swaby, what is schizophrenia?
That's a great question. Schizophrenia is a chronic mental illness that affects the way the brain receives and interprets information from the outside world. This affects thinking and judgment and impairs a person's ability to reason logically, organize and communicate thoughts, and function in society. Schizophrenia does not, I repeat, does not mean split personality.
And how is schizophrenia diagnosed?
The diagnosis of schizophrenia is based on an interview with a doctor. It can be difficult to distinguish schizophrenia from certain other mental illnesses. Therefore, a medical history, physical exam, and laboratory tests are required to rule out other disorders. Doctors also may look at pictures of the brain taken by X-ray. Symptoms provide the most important clues in making a diagnosis. Doctors will look at the type and severity of symptoms and how long they last, and what the person's life was like before symptoms appeared.
And so is there a cure for schizophrenia?
Schizophrenia is a lifelong illness. Although it is not curable, it can be treated. Many people with schizophrenia are now able to lead more independent and satisfying lives through improved treatment.
How is it treated?
Schizophrenia is generally treated with a combination of therapies. These may include antipsychotic medications, supportive therapy, and education about the illness. Antipsychotic medications are considered the mainstay of treatment for schizophrenia. The newer antipsychotic agents known as atypicals act on both negative symptoms and positive symptoms. They also appear to have a relatively low potential for neurological side effects. Supportive psychotherapy is another very important part of treatment. It allows the individual to talk about thoughts, feelings, experiences, problems, and relationships. A trained mental health professional, like a psychiatrist or psychologist, can help the person understand more about the illness. Other forms of supportive therapy include programs for social and vocational training, and psychotherapy is not a substitute for medication therapy.
How do medicines work in the treatment of schizophrenia?
Antipsychotics are the primary medicines used to treat schizophrenia. It is believed that antipsychotic medicines help improve symptoms by adjusting the balance of brain chemicals in persons with schizophrenia. All antipsychotic medications take time to work. It may take several weeks or months before you notice a difference in the way you feel.
Alright, Dr. Swaby. Thanks for your time. We look forward to having you on our show next time.
Thanks for having me.
That's my diagnosis.
Oh, John, you look so plump and juicy. I'm going to eat you.
In the tower above the earth, there is a view that reaches far, where we see the universe. I see the fire, I see the end.
Does anyone else see this?
There is a man of mothers, with his sword, with his robe.
Any dietary restrictions while one is on antipsychotic medicine? Because I knew this kid named John Lim who used to eat whole chickens every Sunday.
Did you say John Lim?
Yes.
He was one of my patients. Give me a moment. Can someone give me a tissue? Thanks. John was a very close patient of mine. And I think I could have done more to save him. But to answer your question, there are no dietary restrictions on a person taking antipsychotic drugs. Although in some patients, antipsychotic drugs might increase one's appetite, but to counteract that, you can drink water or take a walk when you feel hungry.
Did you know John Lim?
Yeah, we went to the same school together. Pretty good friends with him after a few years. We were lab partners this past year, till his strange disappearance.
What happened with that?
I don't really know. All I remember from that day is went to the library. He seemed perfectly fine. I don't know. We parted ways. I never heard from him again. It's tragic.
So did you notice anything strange happened with John within the last year?
Not personally. I don't know. He seems pretty normal when he's around me, but I've heard other people talking about him. About him freaking out, public places, shaming himself.
Have you ever noticed anything strange about your brother?
Well, the other day we went to Rite Aid to pick up some candy, and when I was about to buy my stuff, he started talking to a rabbit. What a freak. I really miss him now.
I know schizophrenia is a genetic disorder. Do you know if anyone else in your family had this problem?
Well, my father, he did some weird things back in the day, but I didn't really think anything of it. But now he's gone.
That's good enough. Where are you gonna order the line? Have you ever noticed anything strange about your brother? You're so happy. Have you ever noticed something strange about your brother?
Yeah, the other day we went to Rite Aid, and I could have sworn he was talking to a rabbit. What a freak. That was way. I really miss him
I'm just feeling celebration tonight.